Kia ora everyone, thank you so much for joining us. My name is Siulolo and I am the Schools and Community Recruitment Advisor for the Faculty of Medical and Health Sciences at the University of Auckland. As part of my role, I provide prospective students with advice about the various programs we offer. Deciding what to study at university can be confusing. However, if you're passionate about making a difference in people's lives, helping and caring for others, and playing a role in the future of healthcare, then one of our undergraduate programs might be the perfect fit for you. Studying with us will open doors to a diverse range of health careers, and we're here to help you become future ready. At the Faculty of Medical and Health Sciences, we offer 6 undergraduate programs. Each of these programs will equip you with the knowledge and skills needed for a rewarding career in medical and health sciences. Our Year 1 programs are our Bachelor of Health Sciences and the Bachelor of Nursing. These are the ones you can apply for directly out of secondary school. Then we have 4 Year 2 programs: Medical Imaging, Medicine, Optometry and Pharmacy. For these programs, you will need to have completed some tertiary study before applying. In this session, you're going to learn about our programs in Medical Imaging, Medicine, Optometry and Pharmacy, including course highlights and entry requirements. It's important to know that to gain entry into our Year 2 programs, you are required to have completed some tertiary study before applying. If you are in your first year of study in the Bachelor of Health Sciences, the degree can provide a pathway where you can apply for our Medicine and Pharmacy programs. If you are in your first year of study in the Bachelor of Science, specialising in biomedical science or equivalent, the degrees provide a pathway where you can apply for our Medical Imaging, Medicine, Optometry and Pharmacy programs. The Bachelor of Science specialising in biomedical science is looked after by our Faculty of Science. You can find out more about the entry requirements for this degree on the university website program page. For all of our Year 2 programs, you will need to apply by 1st of July and complete a multi-mini interview. You can also apply for entry into our Year 2 clinical programs through our admission schemes MAPAS, RAS and UTAS. We have places available in our 4 clinical undergraduate degrees for students entering under these schemes. Our Regional Rural Admission Scheme, RAS, encourages future students of regional and rural origin to train and return to work where they can use their education and skills. Our Māori and Pacific Admission Scheme, MAPAS, provides admission, academic and pastoral support for Māori and Indigenous Pacific students. This scheme is an integral part of Vision 2020, a faculty initiative to increase the number of Māori and Pacific professionals in the health workforce. All students applying under MAPAS are required to submit a MAPAS Supporting Information Form, MH04, in addition to their formal application to the university, and attend a MAPAS general or specialty interview. If you have Māori and/or Indigenous Pacific ancestry and are interested in applying, please contact the faculty for advice and guidance. UTAS are the University Undergraduate Targeted Admission Schemes. If you're a student with a disability or you're from a refugee or constrained economic background, you may be eligible for inclusion in a targeted admission scheme. You can find out more about our admission schemes on the university website. Our Bachelor of Medical Imaging Honours program will prepare you to work in a rewarding role as a medical imaging technologist, where you can contribute to patient diagnosis to help treat different medical conditions. Medical imaging technologists are healthcare professionals who play an important role in healthcare teams, performing X-rays and other specialised examinations that support patient diagnosis. The Bachelor of Medical Imaging is New Zealand's only honours degree in medical imaging. You'll find it's a pretty small class with about 40 students per year, so you'll have plenty of opportunities to build connections with your peers and get to know your lecturers. You'll get real-world clinical experience throughout the program. In fact, The program has 48 weeks of clinical placements in hospitals and private radiology practices where you will be interacting with other healthcare professionals as well as patients. You will be working with cutting-edge imaging equipment in simulation labs, hospitals and outpatient radiology facilities, all while learning how to take great care of patients. So how do you get in? The Bachelor of Medical Imaging Honours involves 4 years of full-time study, 1 year under the Bachelor of Science in Biomedical Science, or an equivalent, and another 3 years after that. So you must be in your first year of undergraduate study in the Bachelor of Science in Biomedical Science, or an equivalent. The first step is to apply for the medical imaging program by the 1st of July in your first year. If you're successful, you will be invited to a multi-mini interview for the Bachelor of Medical Imaging Honours, which takes place mid-year. Then, if you're successful in gaining a place in the program, based on your interview score and GPA, it's another 3 years after that first year before you can be a fully qualified medical imaging technologist. There are many opportunities for careers in the field of medical imaging. Our Bachelor of Medicine and Bachelor of Surgery will help you get ready for a career in medicine where you could have the opportunity to make a significant impact on people's lives. The Bachelor of Medicine and Bachelor of Surgery, or MBCHB as it's also known, involves 6 years of full-time study. Your first year of study will be either the Bachelor of Health Sciences or the Bachelor of Science in Biomedical Sciences. And if you're successful in gaining a place, you will then enter the program in Year 2. You will learn how to diagnose, treat and help others lead healthier lives and get real-world, hands-on experience with our extensive clinical placement opportunities. In Year 2 and 3 of the program, you will be learning all about the different body systems and physiology of your respiratory system, digestive system, reproductive system, neurophysiology, and much more, as well as everything you need to know to start your hospital career and for clinical placement training. In years 4 to 6, you will have hands-on experience with full-time clinical placements at different clinical and community sites. This provides valuable experience in hospital wards, outpatient clinics, general practice, and the community where you will gain experience with a wide range of health problems. You will also have the opportunity to undertake rural placements, where you can engage with rural communities, form connections with community health practitioners, and learn what it's like to practice in a rural setting. Our medical program offers a rural stream for students who are interested in learning about rural medicine. There is also our unique immersion program, where you have the opportunity to spend a full year working in a rural community, such as at a rural general practice or hospital. So how do you get in? The MBCHB comprises 6 years of full-time study, 1 year under the Bachelor of Health Sciences or the Bachelor of Science in Biomedical Science, and another 5 years after that. Graduate entry is also available, but for now, I'll focus on first year entry. So you will need to be in your first year of undergraduate study in either the Bachelor of Health Sciences or the Bachelor of Science in Biomedical Science. The first step is to apply for the medical program by the 1st of July in your first year. You will also need to sit a UCAT ANZ test in that first year. If you're successful, you will be invited to a multi-mini interview which takes place mid-year. Then, if you're successful in gaining a place in the program, based on your interview score, UCAT score, and GPA, you will enter the medical program in Year 2 and continue with 5 years of full-time study. After gaining your Bachelor of Medicine and Bachelor of Surgery, you will need to apply for provisional registration with the Medical Council of New Zealand as a doctor. The next step is to complete 2 years of pre-vocational training as a house officer or a junior doctor. There are many excellent job prospects once you complete the necessary training and registration in your chosen medical field. If you love working with people and want to help our communities, studying towards a career in optometry can be incredibly rewarding. Our Bachelor of Optometry degree will help prepare you for registration as an optometrist. You will gain valuable experience and a broad skill set so that you can practice confidently as an optometrist in the wider community and increasingly in public and private ophthalmology clinics. Optometrists play a crucial role in primary healthcare as the general practitioners of the eye. They work in the community, examining people's eyes, diagnosing and treating visual problems, including early detection of general health conditions such as diabetes. As a student, you will learn how to diagnose visual problems or impairments, advise on the prevention of vision loss, and prescribe and provide treatment. It's a small class with only 60 students each year, so you really get to know your fellow students, the tutors, and lecturers. You get to use a lot of cool technology, and we have a teaching and training site at our Grafton campus. You can book to make an appointment online and get to talk to our final year optometry students. So how do you get in? The Bachelor of Optometry is 5 years of full-time study, 1 year under the Bachelor of Science in Biomedical Science, and another 4 years after that. You will need to be in your first year of undergraduate study in the Bachelor of Science in Biomedical Science or equivalent. Then, the first step is to apply for the optometry program by the 1st of July in your first year. If you're successful, you will be invited to a multi-mini interview for the Bachelor of Optometry, which takes place mid-year. Then, if you successfully gain a place in the program, based on your interview score and GPA, you will go into another 4 years of full-time study to get the skills you need to become a registered optometrist. Optometry offers excellent job prospects and the opportunity to improve people's quality of life through their eye health. Once you complete our Bachelor of Optometry, you can be registered as an optometrist, able to diagnose and treat eye diseases in New Zealand and Australia. Registered pharmacists are medication experts with a crucial role in healthcare teams who help educate people and ensure the safe and effective use of medicines. Our Bachelor of Pharmacy degree will build the foundations you need to undertake a pharmacist internship and ultimately become a registered pharmacist. Our degree helps prepare you to contribute to improving people's health and to work as part of the healthcare team. As a student, you'll experience real hands-on learning in a variety of settings under the guidance of experienced pharmacists. This takes place both in the hospitals and also in pharmacies in the community. Interprofessional learning is a part of this program. This means you get to learn and share classes alongside other health professional students. So, you will be learning alongside people training to be doctors, optometrists, nurses, and other healthcare professionals. This learning method helps prepare you for working in a healthcare team once you are a qualified health professional. So how do you get in? The Bachelor of Pharmacy involves 4 years of full-time study, 1 year under the Bachelor of Health Sciences or the Bachelor of Science, and another 3 years after that as a Bachelor of Pharmacy student. So, to study pharmacy, you will need to be in your first year of undergraduate study in either the Bachelor of Health Sciences, the Bachelor of Science, the Bachelor of Science in Biomedical Science, or an equivalent. The first step is to apply for the pharmacy program by the 1st of July in your first year. If you're successful at the first step, you will be invited to a multi-mini interview for the Bachelor of Pharmacy, which takes place mid-year. Then, if you successfully gain a place in the program, based on your interview score and GPA, you will go into another 3 years of full-time study. Once you complete our Bachelor of Pharmacy and have graduated, your next step is to do a 1-year paid internship in an approved pharmacy setting. On successful completion of the internship year, you will then be able to apply for registration as a pharmacist. Pharmacy is an exciting healthcare field that offers great career paths for those dedicated to helping others. Thank you so much for joining us today. We hope you found the information helpful and now have what you need to know before applying. If you'd like to learn more about our programs, you can get in touch with us by email at auckland.ac.nz/askus. Visit our program pages on the website or pop into one of our student hubs to speak with our expert advisors. As you consider your next steps, remember that we are here to help you every step of the way. You'll be taught by lecturers and researchers who are at the very top of their fields and will support you to become future ready for almost any role in the health industry. We look forward to you being a part of our health whānau.